Well, hello everyone. I want to say thank you for joining me today. This is the first of hopefully several table talks, but I have a very special guest today. Her name is Quintana Stewart. Uh, Briefly, she has a long history, almost 18 years in public health, from everything from a public health educator to an management planner to assistant health director, and now the director for Orange County Health Department. And that's a long time to be doing something, but I'll get into that just a little bit. But I would like to say I hope that this conversation, we have a very big issue that we're dealing with as a world, not just as a county, but
Yes.
we're going to talk a little bit about that, but also health in general. I think that Miss Stewart would agree, like I say, that health is something that's a lifestyle, things that we do not just when we're in emergency situations and virus seasons, but hopefully we do things all our life or most of our lives so that
Yeah.
we can combat some of the health issues. And like I said, we'll talk about some of the details. So I will turn it over to Quintana and say thank you for being with me today. And thank you for taking the time in a very busy, I know, very busy and
Oh,
sometimes stressful time as we're living in a pandemic, and I'm
yeah.
sure for most of us, the lives our first ones all the way around. So the first one where you were at the helm, but I would say when we met because I worked for Family Success Alliance at the time. And one thing I've always appreciated about you is that when you came in and you decided that you wanted to be intentional about how you were going to lead. And one of the things you did, which I told you back then, I don't know if you remember during the council meeting, that I appreciated you saying you want to take the time to learn the organization before you started making changes, dismantling things, adding things, etc. And I thought that was very thoughtful, considerate, and that it was wise because I think you respected the fact that there had been something here before you, and you wanted to learn about it, and you want to make sure you honored and respected it. So I've always admired your intentionality and consideration.
Oh, well, thank you. And thank you so much for asking me to come on and join you today. As you said, I started I started working when I was like 2, right? Because
Yeah, of
how
course.
else
I
would I
said,
have 18 plus years of public health experience? But no, it is you're right. Health is a lifestyle. And it is public health is my life. It's all I've known. It has been my true passion and desire for many, many years. You know, from undergraduate on. But thank you so much for inviting me to come and speak to you today. I welcome um, this nice break from my
oh,
day-to-day
wonderful.
activities of the responding to the COVID pandemic. So I appreciate your request to speak with me today.
Well, I'm glad to hear that. And one of the things that I wanted to get started is a lot of people, I think now this year, right, public health has been one of the many terms, right, top vocabulary words of 2020. But I know for myself personally, I went to UC undergrad and probably was the first time that I guess, delved into public health and heard about it since I had a lot of friends who were interested or majoring in public health. But if you had to describe this to a person who hadn't, in a nutshell, to a layperson, well, how would you describe, what would you say the definition of public health is, because I feel like it covers a whole lot of topics.
It does. Public health, I tell you, if I had to describe it to someone who had no idea what we do, I would say public health is the invisible profession. And
Okay.
so if we are doing our job and things are going well, you don't hear anything from us, you don't see us. And so for me, public health, we embody everything about the way people live, eat, work, play, worship. You know, there's always a public health element there. So our role is really to um, ensure that your environment is safe so that you're able to do all those things. Our role is to be there whenever folks need some education, information, and we offer primary care in Orange County, but health services for prevention and maintenance of disease processes. So yeah, I think public health we just embody everything. And again, whenever we're doing our job and it's working well, we're invisible and you don't see us. And I think for the most part, we prefer that way because that means, things are, are all right with the community. But times like this during a pandemic, we don't shy away from stepping up to take the lead to show folks, what we need to do to mitigate and control disease. For this example, the COVID virus. So, Yeah, so public health is everything, in my opinion. We're everywhere, and we have a role in all facets of the community. So anytime you go out to eat at a restaurant, public health has been there. We're ensuring that it is safe and that we don't have a foodborne outbreak. And you go out to swim and you go to the parks, and public health has been there, ensuring that your pool is safe and up to standards and codes with sanitation and things of that nature. So I feel like we're just all encompassing for public health.
And that's so true. And I really like how you said invisible, right? And when you first described it, that's a great way to put it. When public health is going well, we don't hear a lot about, I think, this year, right? We'll
Yes.
probably confirm and just back you support what you just said. It's been, public health has been in the forefront since, I want to say December last year, but definitely taking precedent of all stories as of January this year.
Yes.
How involved that is, and how many things that covers. So speaking of this year, we have the issue of COVID-19, and it has, as recent as less than 24 hours ago, right? Our governor had a press conference, and we're in a different phase, or excuse me, we're headed to a different phase a little bit. So I know we'll get to that a little bit later. But if and some, we've spoken a few times trying to do this, and I know some things have changed, right? The universities have closed since our original or initial talks about this. They've closed to in-person learning. So let's talk a little bit about, your, I guess, the public health, the health department's involvement in the schools making their decisions, be it universities, K-12, or how involved are y'all with as institutions are deciding how to bring people in buildings or back into buildings?
Yeah. So I feel very fortunate here in Orange County. We have a great working relationship with our K-12 schools, both school districts, and the university. So we've been really involved for months now, meeting with the schools and looking over plans and, outlining different performance metrics that maybe we should consider and track to determine whenever the spread of the virus in our community is maybe low enough that it would be safe enough for everyone to return to in-person classes. So while I can't attend all meetings, I have a great team that works with me daily. I have the best team, I think, this side of heaven, right? So we divvy it up. And so I do have team members that go and they meet with the Orange County School District and work very closely with them, looking at their plans and the setup of their classrooms and, the needs of their staff. And they do the same thing with the Chapel Hill Carborough District. With the university, I have been a little more hands-on, but I personally meet with the provost and the chancellor daily. We have briefings at the end of each day. We were meeting, months before school was to reopen, talking about plans and, what to do. And so I feel fortunate. We have great working relationships, and we all sit down and we talk about this stuff together. While, we understand communicable disease and how it's spread, the one piece that none of us can control is human behavior. So that's always the wild card, the unknown. But we try as best we can to make plans to prepare for, worst case scenario of if the humans behave this way, then we do this.
So are you able to answer the question as a health director, do you think it's wise for universities and for school districts to do the virtual learning at this point in the fight against COVID?
Right. And I don't know that the issue was so much with sitting in the classroom because, in the classroom, you have a lot more structure and you can space out the seats and where students are sitting. The issue is everything that happens in between, getting into the classroom and whenever you leave the actual classroom with the formal instruction. So I think it's wise. I feel like all of our institutes of learning have made wise choices moving to the virtual platform at this time until we get a handle on the spread of the disease in our community, until there is, some kind of solid treatment for the virus, a vaccine maybe for the virus. I think we're doing the right thing to protect our community at this time.
Oh, wonderful. And so one of the things we talked about is the rapid changes, right? We've been through several phases now. We've been through, we're going to do this and we're going to stop doing that. So and as recent as yesterday, our governor announced that we're going to move towards phase 2.5 out of 3 phases, which I was surprised by yesterday, if I'm being honest. I thought that we were getting further away from movement. So that to me was a little bit a glimmer of a hope. And for us, that meant two things I heard him say. I heard him say that that meant that gyms could open as of Friday at 4 o'clock, this Friday at 4 o'clock at 30% capacity, and that
Mhm.
parks could reopen. I guess all parks now could reopen. And then they increased the number of people who should be indoors together and outdoors together. I think it was 50 outdoors and 25 indoors. But he
Mhm.
has always been I think a leader who said, but counties can do what they want to do. So I'll let you speak on, if you can, at this time about
Yes.
Orange County.
Yep. So, yep, we all enjoyed the governor's briefing yesterday. But I do understand, and if you saw the briefing and got a chance to review some of the data, when you look at how we're doing overall as a state, things appear to be stabilizing. Some of the measures are actually starting to decrease, which is a good thing. Um, However, I say if we look at just what's going on here in Orange County, we're not moving in that direction right now. So, and it's just how it happened. But for the longest, we had lower numbers, and our percent positive test rate was really low. We had gotten down to like 2.4%, and
Mhm.
today I looked and we're up to 9.6. And so that's the ideal rate would be 5% or lower. And so
Yeah.
even at 9.6, I see a little progress, because when I looked this time last week, it was at 12.4%, right?
Okay.
Um, yeah.
Effective,
So here
yes.
in Orange County, and I'm not going to say it is solely due to the university reopening. It could be multiple reasons for the increase in our cases, but that played a part. It had its factor in the situation. But we had an increase in our community members that have come back for school, right? And so we did see an increase in our cases. So that's not ideal, and it's not moving in the right direction. So you're right. The governor has always been clear that counties can make more rigid kind of policy and rules during this response, because he understands sometimes we may need to tailor things to fit what is going on in our community and not what's happening statewide.
That's
Um, at this time, I don't know what our local county officials will decide to do, but I know they are looking at our data here in the county. And so we're waiting to see what the final decision will be. Um, so we may not move in the same direction completely as the governor's orders.
okay. And then you mentioned it. So in our county, we also have two school districts, and not every county in North Carolina has that anymore. So we have the city and county schools, and I'm in the city school district. And they decided very early on that they were going to sit out the entire semester. Well, I'm sorry, have virtual learning the entire semester, meaning sit outside the building um, from home. And that at some point before January, they would determine what we do. And I'm sure, the numbers, like you said, it'll be what our county looks like, right? Number
Hmm.
wise, I'm sure. And then the other thing to take into account is, you know, respiratory virus season, right? It's upon us. We're weeks away now because we're in September. So October
Absolutely.
starts then. So, I'm sure there are a lot of things that you guys have to weigh when you have this conversation with them and them making the decision to go back in. But, from your, I guess, looking at it from your perspective, should we be concerned about us going into respiratory virus season? So RSV and the flu and a few other things that happen on a typical year between October and I think it's April.
Hmm.
That on a regular season can affect tons of people. So
Right.
how does that factor in with COVID-19 and
So
making
I
these?
think, yes, I think we have to continue to be vigilant around it, because to date, we've been only focusing on COVID-19, but you're right, we're getting ready to roll into the fall season with all the other respiratory viruses that come visit us. And because a lot of the symptoms are so close and they're similar, it will be hard to just kind of look at it on its face and say, oh, you seem like you have the flu. We really won't know. So, you know, I'm really going to encourage everyone to continue practicing the pandemic prevention strategies that we've been talking about, the 3 W's. I laugh and I put this, I feel like in the in the end of every message that I send out to staff and when I put in the newsletter, I said, I think I said it this past month. I said, I know you guys are saying she sounds like a broken record, but it works if everyone would truly adopt the 3 W's and, wear the face mask, wash your hands frequently, and wait the 6 feet in between whenever you're out in public. It works. And I think Orange County is a testament that, the community, we got on board and we were following this guidance. And so we were able to suppress our numbers a bit, and we got that percent positive rate down. So I would encourage folks to continue to be vigilant during the fall season into winter, so that we can again ward off the spread of these respiratory viruses.
Okay. And just a few more questions about this, and then we'll kind of change the topic a little bit from COVID to other health things. But one of the things I would say is I'm a person who always looks for the sunny side, right? Like there are pros and cons to everything that's positive. And one of the things that I have appreciated during this time, even though we've had to pause, I want to say pause, a lot of things that we do typically, and we've been limited in how we can do things. And in my house, we've been, pretty close to quarantine, very limited activity outside the home other than in our neighborhood, our yard, that type thing, is that there's been some innovative things that have come out of this, right? One of the things that I've enjoyed seeing has been the parades. So parades to commemorate graduations, birthdays.
Oh, yeah.
So that's when the families or friends will get a caravan of cars and friends to sign up to make signs and balloons. And then at some given date and time, they come through to the person's house, the honoree's house, and they parade cars. And we did it one time for one of my children at the end of the school year, and I've seen that happen. I want to say, I wouldn't have thought of that, but I think that has been a way to commemorate special moments without having to congregate, right? That you pass through in your car, so people aren't getting out. Typically, sometimes people hand out things, but again, it's in passing. It's not. And I've seen people with masks and gloves and things like that in those cases. But have you seen anything? Have you done anything that's innovative or to kind of modify how you celebrate? And I should say, my background, like I'm an event planner by trade, and so I have.
Okay.
My industry has been paused right now, right? It's been how we gather, how I gather people has been very different. It's been mostly virtual or catering small things, but I've appreciated things like the parade that have come to the forefront to help commemorate, special occasions.
Yeah, so I have participated in some of these innovative ideas. I had a goddaughter that graduated high school back in the spring, and we absolutely had to do the drive-by parade thing. She was fortunate they allowed her to have a second car, so my husband and I, we were able to follow behind her and her parents in their car for her actual drive-up graduation, so we could witness and see it and take the pictures. So that was phenomenal because sitting in my role, I did get a chance to review and hear about some of the plans for high school graduations, but to go, and it was in another county, I was in Guilford County, but to actually go and be a part of it, I was so impressed, and everyone was disciplined and everyone had on their mask. And so it warmed my heart that, while they had a very unique senior year, they still were able to celebrate and do something. So she still got the cap and gown picture of her receiving her diploma. So I thought that was great. I also had a chance to had a cousin that purchased a house about a month ago, and so she had a drive-by housewarming. And so that was interesting. So yeah, getting a chance to see family and friends. We were just driving by and dropping off our gifts, on the table right outside at the mailbox. It was nice. And I think the one event that I really enjoyed, and it kind of brought tears to my eyes. I come from a really big family, so this has been hard on my extended family because we gather for everything. I mean, we celebrate everything. And so I have a cousin, a smaller cousin, and for his first birthday, we did a big Zoom party. And it was just the sweetest thing to get a chance to watch him, like, dive into the cake and dance, and then everybody had their turn to speak and talk to him. And I remember sitting there and my husband said, "What is wrong with you?" Because the tears were just flowing. But that was also the first time that I had visually seen lots of my family members since the pandemic started. So that was the one event that I will always remember.
I thank you for sharing that, and I think that's beautiful. I've heard about the Zoom parties, and
Yeah.
it warms my heart as an event planner that people are still looking for ways to connect, because it
Yeah.
has been, like you said, for people with big families or you were used to gathering, to have
Hmm.
to all of a sudden to come to an abrupt stop and
Yeah.
to not know when we can do that again at the level that we are used to.
Hmm.
I'm glad that people are filling in the gaps. They're thinking of ways to still stay connected. And so what I have said too to my family and friends is that I'm thankful that the internet exists, because could you imagine 25, 30 years
I
ago going through this?
know.
We would all be sick puppies, right? We
Yes.
would, because some of this we wouldn't be able to coordinate to plan and do the Zoom, virtual party, having this interview and a few other things would
Hmm.
not be able to work from home, all
Yeah.
those things. So that's when I'm very thankful for technological advances, right? That
Mhm.
it could be worse. Right?
Yes,
But
that is so
I was
true.
pretty
That
bad,
is
but it could be worse. So I'm thinking that I'm glad for your cousin. That's wonderful
yeah.
that you have any new hobbies or interests that you have picked up during the time. I know a lot of people have. I've tried to pick up piano that has not worked out.
Oh. Well, I have to be honest. I probably have not done the best job at work-life balance. So I've spent a lot of time working, probably working. It's off. But in the event, or when, yeah, at work, it's the season right now. But
Yeah.
when we do have a little downtime, like Monday's a holiday, so technically, you know, government offices will be closed. So things that I enjoy trying to do, I'm not great at it. I try cooking new things, trying new
Oh,
dishes.
wonderful. Wonderful.
Yeah.
Wonderful. 'Cause we do indoor outdoor cooking right now, so I love it. That's the other thing. Cooking is one of my hobbies and
Oh,
passions. So I'm glad to hear that. So if you need any
okay.
recipes, let me know. If you want to
Thank
try
you.
something.
So my new love is the air fryer, right? 'Cause I'm always
Oh,
trying to think how to eat things, but do it in a healthy way, and letting go of the fried food. So I have fallen in love with my air fryer, and it just stays on the counter now, and I don't think there's a meal that goes by that I don't use it.
that's wonderful. I don't have one, but for the people who I know that do, they rave about it. Like they
Oh,
love with
I
it. They really like
love
it.
it.
So I'm glad
Yes,
you're another person, another reason why I probably should go out and get one.
I
Right?
think you should check it out, Beatrice. It's great.
Wonderful. That's wonderful. Well, speaking of like eating healthy, you mentioned this earlier when you talked about the health department. You guys
Mhm.
have two clinics, you say, and a dental clinic, be a health clinic, and then a dental clinic. And one of the things you try to do is to again have people have a lifestyle that's healthy, so that when illnesses come, you're in a better position, right? Or
Mhm.
again to have long life, to just to have what I call health and wellness, right? That when our
Mhm.
bodies are in good condition, then how we show up in the world is different. It's a positive light. So, are there any new programs that you guys are doing, not COVID related per se, but any campaigns or things that you like to highlight in the Orange County Health Department, or maybe statewide, that's going on to help people stay healthy?
Right. So I will say again, because like I told you before, I have an awesome team, right? So I applaud the team's ability to pivot and shift their way of offering services during this pandemic. So in our clinics, we've actually moved and we offer telehealth appointments, and that's not something that we used to do in the past. But our health promotion staff, they are also offering services on the virtual platform. So our
Mhm.
diabetes nutrition classes, they can also now be taken virtually. And then our smoking cessation classes, they continue. And so she offers those courses virtually. So those are just a couple things that I would say we are doing. And I really appreciate and I love their spirit to continue to reach out and connect with the needs of the community, even if we're limited and we can't do it, in person, face to face. So
And that's wonderful, because health is something. Even though we've been largely focused on one thing, there are still other health conditions and
mhm,
lifestyle choices, et cetera, that need to be addressed. And so I'm encouraged to hear that that life goes on, right, and things are going to maybe in a different delivery system, but
right.
people are still able to access those services.
Hmm.
Um, what about any final thoughts? Anything you'd like us to know that we haven't talked about today as it relates to the health department, maybe public health, for example? I'm sure there may be a lot of people who who have gone through 2020 so far and said, you know what, I like to be an epidemiologist, or I like to be a or I'll do what suggestions would you give them if they were thinking about a career in or career change in public health? What would you say to them? What
I
advice?
would say, come on down. We're taking all public health practitioners. But honestly, I would say if someone is intrigued, and I did have a student reach out to me and
Mhm.
ask me a very similar question, wanting to know, am I headed on the right track if I want to someday, be in public health, be a health director? And I thought, yes. But I would say be open to many of the community health types of classwork. We absolutely can use all the epidemiologists, because one thing that I know my team wishes we had plenty more of would be like the data folks, the people that can comb through the data and tell us, okay, so what is the story that this data is telling us about what's going on in our community? The folks that I have, again, they are excellent. And if I could clone them, I would, so they wouldn't have to work so many long hours. But yeah, I would encourage folks to pursue that passion and look it up. I mean, North Carolina, we are home to so
Yeah.
many great state schools that
Yeah.
offer the public health curriculum and that track for a degree. I am a health educator to my toes. Like, it is my first love, my passion. And so some folks would probably be amazed to know the health director, you are out working at a testing event. But yes, while I do have to do the administrative work, that is the job. I am tasked with doing that. But I just can't totally disconnect from community and going out and just having my hand in some of the service work that we offer. So the team will tell you, I will go out and I'll put on my t-shirt and jeans and I'll show up at a testing event too, because I still need that connection, to know that the service that we're doing is to help improve the overall health of our community. So I would tell folks to, you give me a call, shoot me an email. I can tell you about some really good schools, and we got one right here in our backyard. UNC Gillen School of Public Health is a global, nationally, recognized school, right? um, but yeah, I would encourage folks to follow your passion. I didn't start off as a public health major. I actually started off in undergrad as a nursing major. Um,
Okay.
I went to East Carolina on a nurse scholarship the first 2 years, and you
My
know,
hometown.
oh, Greenville, huh? Okay, good times, I tell you. But what I learned early on, and I had to be true to what was, feeding my soul and what I thought I would be happy in long term. So I knew I wanted to do something in healthcare, but it wasn't the clinical side and the nursing side. I had a chance to get my CNA license, and I worked for 2 years, as a CNA in between school on summer breaks and holidays. But I learned early on that the clinical side and the blood and the death and the dying, that wasn't for me. So I went back to school and said, I want to do healthcare, but I don't want to do this part of it. And so my advisor said, you should look into public health education. And I said, yeah, I want to do something to help folks before they get to this stage of care and need. And so that's where I pivoted, and I started, studying public health, and community health education was the major exactly. But from there, I've been in it and had a chance to kind of work and focus on different aspects of public health. And again, I love it. I just couldn't imagine what else I would do if I was not working in public health. So it's a
Well, I
rewarding job.
I love, you said a lot of things. I'm gonna see if I can remember some of them, but one of them is passion. So I can tell that you're passionate about it, and that makes a ton of sense that you would still be at a testing site hands on, because when you're passionate about something, no matter how high or in administration you may go, you always go back to the roots. And I think that just again speaks to who you are as a leader and a director. That your genuine concern is not about reaching some kind of career ceiling, et cetera, but it's really about impacting your community,
Yes.
and being able to do the work regardless of the state. One of the reasons why I went over your bio is because I could see from what you've done that you kind of touched on a lot of different things, right, to get you where you are today. But you, like you said, you still are hands-on because of COVID. You've been in the community several times testing folks to make sure that, people are healthy or have concerns to answer questions. And then the other thing you talked about was, once again, how broad public health is, when you said that you wish you had data people. So if people are listening and watching and they are into statistics and data, and seeing why the question people ask often during this pandemic is, well, why do they say wear a mask and people are still getting sick and I'm wearing my mask every day? How you can dive into the yellow lines Dr. Cohen talks about, right? Those type things. Everything from that to like being a nurse or being a health educator. And that's another thing I don't think people talk about a lot. That was my first contact with public health, was with people who were interested in being health educators, people who are actually trained in specific topics to go into communities to have conversations, like grassroots, I say community conversations about how this issue, particular issue, could be diabetes, like you mentioned earlier, or smoking, right? To show how it affects communities and what we can do and what resources are naturally in our communities to help us become better, healthier, and well human beings. So I'm excited for you, and I'm glad that I love when people do what they're passionate about, because then it doesn't feel like work. Just, you talked about work-life balance,
Right,
not.
it doesn't.
I'm sure you feel like you're in your element when you're working, and when you get a chance to relax, you do. So I get it. I'm sure a lot of people, it resonates with a lot of people who are watching this. And then I think the other thing that I find inspirational is, you can still see that you're happy, almost 2 decades into it, which I can't believe that, but almost 2 decades into
Remember,
it.
I started when I was 2. I started working at 2.
The poster wasn't a crayon. But that you're still, it seems to be very involved, very adamant, very passionate, and that you're enjoying what you do, which I'm sure people around who work around you appreciate that too. So kudos to you for finding something. And like you said, it was something that evolved, like a nursemaid. I didn't know that, but I think I had friends who did the same, that they wanted to be doctors, but then they decided, no, I want to be in the health field, but to do something different than clinical. But we all have our strengths and the areas that we should be in. And I like that you said that you're open to people calling and writing you to find out, how you got started, or asking questions about, what career path. So that's, you giving back to the community, and being available. Because I feel like, sometimes people are looking for the right person to connect with, or some advice, because some of us come from communities or areas where we may be the first one or the only one. And with that being said, to have somebody in place who says, hey, just, my door's open anytime you have questions or you want to know. And you can determine, or even shadow visit once we get to a point where we can do those
right.
that those are, it helps broaden, other people's horizons. So thank you for giving back. Thank you for being available, and for all the work that you've been doing before 2020, but definitely during this crucial time.
Oh, thank you. I appreciate it. And again, I love it. I enjoy it. So it's
Well,
my
thank
pleasure.
you. Well, I hope some things were said today to enlighten you about our current conditions around COVID-19, about health in general, and then specifically if you live in Orange County, North Carolina, then maybe you learned something that either will incite you to keep doing what you're doing as it means protecting you and your health and your family and community, or maybe you learned something that you're curious about and you want to reach out to me or to Quintana or to the Orange County Health Department and find out more information. But again, we're hoping that people will continue to maintain a healthy lifestyle. And one thing I do like about the health department, and that's the case, I think, across the country, is that it's accessible health care. So if you do have any questions, please, you can contact the health department. You might can't get it some other places. There's a lot of issues around insurance, et cetera, et cetera. But the health department is a more accessible, sometimes medium or delivery of healthcare services. So please don't count them out. Consider them when you're thinking about ways to stay healthy during this season. So thank you again, Quintana, and I'm sure I will talk to you soon as we still work together in other capacities. So
That's
thank you,
right.
everybody. Have a wonderful day.
Thank you.